Well, hello everyone. My name is Grace Suva, and it is a pleasure to welcome you today to this webinar entitled Indigenous Mental Wellness. This webinar is hosted by the Registered Nurses Association of Ontario in partnership with Nishnawbe Aski Nation, the Chiefs of Ontario, the Centre for Addiction and Mental Health, the Canadian Indigenous Nurses Association, and the Ontario First Nation Young People's Council. We recognize that our work and the work of RNAO members takes place on the traditional Indigenous territories across Ontario. We also wish to acknowledge that the office of the RNAO is located on the traditional and unceded territory of the Huron-Wendat, Haudenosaunee, and most recently, the territory of the Mississaugas of the Credit. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We also recognize that tonight's webinar participants are located in other traditional lands across Ontario. And today, this land is still the home to many First Nations, Inuit, and Métis peoples from across Turtle Island. And we are grateful to have the opportunity to work on this territory. By personally making a land acknowledgement, you are taking part in an act of reconciliation, honoring the land and Indigenous heritage, which dates back to over 10,000 years. We encourage you to learn about the land you reside on and the trees that are attached to it. Land acknowledgements are an act of reconciliation, and we must all do our part. I'd like to introduce you to Mary Deliri, who will be doing the traditional opening today. She is Algonquin Anishinaabe, originating from the First Nation community of Kitigan Zibi. For Mary, a lifelong dedication to the pursuit of Indigenous knowledge and practice is grounded and nurtured through the Mindiwiwin way of the heart. Mary serves in a leadership role within the Thunderbird Partnership Foundation, providing expertise in Indigenous knowledge exchange translation, and holds the position of training and education manager. I'm now going to turn it over to Elder Mary. Which Elder Mary, thank you very much. Before we proceed with today's presentation, just wanted to cover a few things. First off is that the objectives of today's webinar are to, one, describe the link to the First Nations Mental Wellness Continuum Framework as a way of addressing and problem statements and assumptions. Number two, to identify and descript any key factors influencing culturally safe services. And number three, to provide recommendations for achieving Indigenous wellness, hope, belonging, meaning, and purpose. So before I pass it on to May, who is the moderator for today, just a few housekeeping items. First, can everyone please turn off their microphones and cameras, just because we want to be able to have enough bandwidth to be able to hear everyone today who's on presenting. Participants, you can ask your questions, the Q&A, and any comments in the chat box, and we'll have about 20 minutes at the end of the presentations for Q&A as well as networking. And wanted to let you know that this webinar will also be recorded and archived for future viewing, and a link will be sent out to all participants. The webinar is also being accredited with 2.5 hours by the Indigenous Accreditation Board of Canada. And the accredited hours are documented on the certificate of attendance and that you will receive once you complete the evaluation survey. Okay, so the moderator for today's webinar is May Cat, and she is a primary healthcare nurse practitioner. She holds a degree in nursing, Master of Education, and has received an honorary doctorate of laws degree from Trent University. She coordinates a mobile treatment program that provides opiate agonist treatment for Suboxone in remote and rural First Nations communities, and has led the creation and implementation of a Suboxone program in a local First Nations high school. She is a member of the Nishnawbe Aski Nation COVID-19 task team, advising leadership on pandemic planning and responses. May is also on the NAN Health Transformation Advisory Council. So before I turn it over to May, I'd like to invite Dr. Doris Greenspan, RNAO CEO, as well as Marilee Naugizik, CINA's CEO, to bring greetings to all of you today.
So Marilee first, please.
What a way to trip up the schedule there, Doris. Thank you very much, Doris. Greetings to everyone. I'd like to take this opportunity to, first of all, welcome all Indigenous and non-Indigenous nurses to this very fulfilled and I think very content-packed webinar, and I'm sure that you will enjoy it. I know that we've enjoyed planning it for you. I'd like to also recognize the land, the territory on which I am on this evening. I am coming from the unceded territory of the Algonquin and Nishnawbe people here in the National Capital Region, Ottawa. I'd like to thank Mary, our elder, for setting the stage for tonight so that we can learn in this time of sharing and under such difficult times. CINA, for the past 47 years, has been the voice for Indigenous nurses, First Nations, Inuit, and Métis across the country. And therefore, we feel very privileged to share this platform with my colleagues tonight, and especially our hosts at RNAO. I'm wishing safety to all of you in your communities, wherever you may be coming from this evening, wherever you may be joining us. And I hope that you're sharing this time with others whom are sharing the wealth, depth, and loyalty that you have to your profession. May tonight also assist you in your continued professional journey in your respective paths as you move forward in a very difficult time. If you've not already done so, please consider your membership with CINA and help us continue as we move forward into the next stages as we reach with you truth and reconciliation. We look forward to this evening. Chimigwech, Chimigwech.
I thank you so very much. I am speaking to you from the Mississauga of the Credit, the Nishnawbe Kanopishua territory where I live. I am bringing greetings from RNAO and very thankful for Mary, your incredible remarks and for the peace of mind and the peace of soul that you bring to us. And for RNAO to be involved with you and for the learnings that we will have this evening. Thank you very much. And to my friend and guru Maykat for moderating today, and for Grace and Tanya and the entire committee for planning the evening. Thank you, Miigwech. And Rachel, I think Rachel is with us too, right? Is Rachel with us today?
Not right now.
Okay.
No worries.
Thank you.
And May, I'll pass it on to you.
Good evening, everyone. I'm coming to you tonight from the traditional territory of the Fort William First Nation, Marilee's homeland. So welcome, everyone. We're excited to bring you the fourth webinar in a series of webinars that's been focused around cultural and Indigenous ways of healing and keeping well. We know that culture and caring is so important to the workforce that's working with our people across the country and Ontario specifically. So we do want to support the workforce. We know that 18 months of the pandemic has been difficult for everyone. Our caregivers, our physicians, our nurses, our social workers, psychologists, you name it. We all became health workers during this pandemic. Globally, our job is to protect people. So thank you for joining today and learning about Indigenous ways of wellness. We were going to start tonight with really look at where you're at. So we'd like to use Answer Garden software to ask a few questions, and we welcome your participation. So please note that the questions asked and the data collected will help inform today's presentation. We will ask 4 questions. Kindly use the link in the chat box to answer each of the questions. And the questions are: where are you joining us from today? What sector do you work? And if you're a medical or nursing student, please let us know what year you're in. And or what school you're in. Please self-identify as First Nation, Inuit, Métis, settler, or ally. And what is your favorite hobby? So we'll give you time. Tanya's collecting all the information, and we'll see what that garden brings to us tonight.
We'll move on to question 2.
Pardon?
The majority of participants from today are coming to us from Toronto. There's quite a few from Sudbury, London, Mississauga, Ottawa, Ontario. Thank you. Got some out of province. So that's great. I put the second link in the chat. And I'm going to go ahead and
I can do that.
so the question is, what sector do you work with?
So we have a nursing student, education, healthcare, year 1 nursing, year 1 NIPSing student, acute care hospital, social work, justice, community services, and addiction counselor, child welfare, RPN to BSCN student, children's mental health, developmental service, health and social. Quite a variety of work-related services.
Thank you for sharing. And we'll go to question number 3. What sector do you work with? And if you're a medical or nursing student, please identify what year and or school you're in. And I'm entering the link in the chat box now.
We have question 3 is self-identifying as First Nation, Métis, Inuit, and settler.
Okay.
I'm going to put the link in.
Okay. My apologies.
That's okay. So we have First Nation, Nishnawbe, white settler, neither. I am Black, First Nations, year 1 NIPSing, settler, ally. Welcome everyone. First Nation, Mohawk, Ojibwe, Nishnawbe, neither. None of the above, Cree, ally, 4th year social work program, federal government, settler, First Nations.
Okay, thank you everyone. And question number 5, I hope I have this right. A fun one, what's your favorite hobby? And I'm putting the link in now.
Somebody put socializing, must be hard during a pandemic. Dancing, kayaking, golfing, yes. Video games, painting, exercise, writing and painting, yoga, reading and hiking seems to be getting a lot of answers, knitting. Gardening, singing. People are finding many ways to keep well, drumming and singing, blending teas, old movies, lacrosse, fishing and hunting, playing with my puppy, video games, musical theater, dramatic arts, horseback riding, Netflix. Yes, go Netflix. So hiking and reading seem to be the majority of the answers. Thank you for all that. Now I'd like to introduce you to Carol Hopkins and Brenda Restool, today's special guest speakers. Carol Hopkins is the Chief Executive Officer of the Thunder Bay Partnerships Foundation, which is a division of the National Native Addictions Partnership Foundation, and is of Lenape Nation at Moravian Town, Ontario. Carol was appointed as an officer of the Order of Canada in 2018. In 2019, she was recognized with an honorary Doctorate of Laws degree from Western University. Carol Hopkins has spent more than 25 years in the field of First Nations substance use and mental health. She holds a Master of Social Work degree from the University of Toronto and a degree in Sacred Indigenous Knowledge equivalent to a PhD in Western-based education systems. Carol has co-chaired national initiatives known for best practice in national policy review and development, resulting in the First Nations Mental Wellness Continuum Framework, the Honoring Our Strengths, a renewed framework to address substance use issues among First Nations in Canada, the Indigenous Wellness Framework, and the Native Wellness Assessment. Her leadership has been engaged within health for provincial and federal governments as well. Thank you, Carol, for coming on tonight. Our second guest speaker is Brenda M. Restool. Dr. Restool is from the Dokis First Nation, Nishnawbe, Ojibwe, and is from the Eagle Clan. Dr. Restool is a clinical psychologist and the Chief Executive Officer of the First Peoples Wellness Circle, an Indigenous-led organization dedicated to raising the profile of Indigenous mental health using Indigenous knowledge and evidence. Dr. Restool has worked for over 20 years with First Nations people in a variety of settings and uses a two-eyed seeing approach that highlights cultural practices and knowledge throughout her work. From her clinical practice, community development, and capacity building work, to working alongside First Nations, provincial, territorial, and federal governments in advancing and transforming Indigenous mental health. She is known for her work with the First Nation Mental Wellness Continuum Framework and supporting the mental wellness workforce in First Nations communities. She has particular interest in cultural safety, First Nations community development and capacity building, and reducing suicide rates in First Nation communities using First Nation knowledge and practice. So welcome to the speakers. We are going to remind you to submit your questions under Q&A feature, and we will relay those questions at the end of the Q&A. We're going to start with Carol. Carol, you're going first tonight, so please start with your slide, and thank you very much for being here.
Thank you very much for the introduction, and I'm just putting my slide up. Good, you can see that. Indigenous gaye maingan and dodem lane lanape kwe and dao lanape a king and donjaba nigabe mede kwe. I am joining you from the Lenape Nation, otherwise known as the Delaware Nation in southwestern Ontario. My mother is from this community, which is also the host of the head office of Thunderbird Partnership Foundation, and my father is from the Munsee Delaware Nation just outside of London, Ontario. Both communities are along the Thames River. I'm a grandmother of 9 and a mother to 4 adult children. And I'm happy to be with you tonight. I'm going to be talking about Indigenous wellness and specifically talking about the First Nations Mental Wellness Continuum Framework that you heard me mention in both the bios of myself and Brenda. And what I'm going to do is use substance use as an example to talk about each of the themes of the mental wellness continuum framework. So culture as a foundation, community development, ownership and capacity building, quality care systems and competent service delivery, collaboration with partners, and enhanced flexible funding. Those are the 5 themes of the very comprehensive mental wellness continuum framework. And I'm applying those 5 themes throughout the presentation. And there we go. So culture as a foundation. What I want to talk to you then about is culture-based practice and practitioners, elders, language, meaning Indigenous languages, First Nations language, land, and the use of traditional medicines are all examples that are applied in the field of addressing substance use. And so I'm going to share those things with you, but I want to position this by saying they're examples. It's not everything. Culture is of Indigenous people is very comprehensive. It's a way of life. It's not a religion. It's not based on rules and regulations, but it is based on our teachings that are rooted and stem from our stories of creation. And I don't want you to be confused either by the English word stories, because it doesn't quite capture the meaning of our culture and our knowledge. I want to first start off by saying that when we leave culture out, or we leave out Indigenous knowledge, there are significant limitations that we have to be aware of. And most significantly is that when we focus on treating the disease or the deficits or the problems and the issues, then we don't know anything about what our efforts contribute towards wellness. And what does wellness look like? And who plays a role in facilitating wellness? And where is the foundation of wellness? So these are questions that we have to ask ourselves when we leave culture out, when we leave Indigenous knowledge out of our practice in the way that we support individuals in their health and wellness. For Indigenous people who have lived now for a long period of time with a disconnection to our culture, and that stemming from all of the colonization practices that still exist today, what we end up with is internalized oppression, internalized racism, where we have been removed from our identity or disconnected from our identity. We've been removed or disconnected from the source of our life, which is the land, our language, our culture, our knowledge, our medicines. And what it's been replaced with is a story that discounts our way of being, discounts our identity, all of the different ways that racism appears. And so slowly over time, sometimes without not even recognizing it, we start to take on that story. We start to take on that image and those descriptions. And so decolonization is the awareness of our thoughts, feelings, and actions, and the oppression that is laden within the way of thinking, the way that we believe are the solutions, the evidence that we draw upon, and then the practices that we support. So being aware of how have we internalized racism, whether it's slightly or very overtly. How have we internalized oppression or facilitated the internalization of oppression is critically important. that there is that awareness to make room for learning. Indigenous knowledge and culture-based evidence. Elder Jim Dumont, who we have worked with quite a bit and spent a lot of time working with him in a research project called Culture as Intervention. And it was a CIHR funded project over 3 years. And we wanted to define wellness from an Indigenous lens, from our sacred knowledge from community stories that have been passed on from generation to generation. And at the start of our conversation, he reminded us of a teaching that he had heard from his elders. And he said that some days someone's going to call us on it, the statements that we make, like our way is the way of the circle. Our way is the way of the four directions. Our way is a holistic way of life, that we're environmentally conscious. And so we've gone through a period of time where we've described our culture using those terms, but we haven't been able to describe what exactly that means, or how do we put it into practice? How do we make those sayings, those beliefs, part of our programs, our formal programs and services, are a part of policy? And so he said, we're in that time now. People are looking for those answers. We need to be able to explain that. And we need to understand how that's translated, how it sits alongside what is familiar, which is the Western empirical evidence. We need to be able to apply it to our life circumstances today, because in our story of creation, it says that what the Creator gave to us, what the Great Spirit gave to us at the very beginning, before there was any physical life, was given forever and all time. That means that knowledge transcends generations, transcends time. And every generation of people have the ability to apply that knowledge in the what was given, to apply to the contemporary context and what we're facing. It's important to also remember that culture is not superficial. It's not just behavioral. And so we spent a long time talking about cross-cultural education. We spent a long time talking about the behavioral aspects of Indigenous people, especially in education. And the thought was that if I teach you the customs of my people, my nation, that will help you to understand us better and we'll have a better relationship. But we know now that is not the case, because our culture is much more than what we do and how we behave. I'm going to share this story with you as an example. And this comes from youth residential treatment for inhalant abuse. So in this program that was culturally based, we would have elders come in and do an assessment with the youth, elders, cultural practitioners. So we did the mental health assessment, the substance use assessment, we did physical assessment, dental assessments, because of the licensing standards to serve a vulnerable population in a residential environment. But our program was culturally based. And so we wanted to have elders come in and sit with the youth and conduct an assessment as well, but from a spiritual perspective, from a cultural perspective. And so that's what they would do. They would come and they would sit with the youth and they'd spend some time talking with them, introducing themselves, building some rapport, a relationship. And then they would talk about why they were there for treatment, or what the youth thought that they were there for treatment for, and what was going on in their life. And so that would happen at the beginning of the program, and the elders would either conduct a ceremony or give us instructions for helping the youth with some aspect of their life from a cultural perspective. It was, of course, by choice. And so most of the youth were very curious, and so they participated out of curiosity. In this situation, there was a young man. He was tall, he was big, he reminded me of a bear. He looked just like a bear. He had lots of muscles. He was very young, though. He was really tall for his size, muscular. And so he controlled his environment by his physical presence. So if he wasn't getting what he wanted the way he wanted it and when he wanted it, he would intimidate people. He would punch the wall or get in your face or threaten some of the other youth in the program. And of course, the reaction was always fear. So he was able to control the environment quite a bit. And because he was in control, he decided that he was not going to see the elders. He really didn't understand what they were doing and why they were there. And from his perspective, it was another couple of adults trying to tell him what to do with his life. But as the youth came out, finished their session, he would ask them questions. And so by the end, his curiosity had peaked and he decided he was going to go and sit with the elders. So they started having a conversation. It led eventually to a question. And the question was, had he ever experienced any trauma around his neck? And they didn't use the word trauma. But they described what trauma was like. Was he ever hurt? Did he have any injuries? Did he have any trouble breathing or swallowing? Those kinds of things. And he was annoyed with the question. And his response was aggressive. And he challenged them. And then he finally said, well, why are you asking me that question? Which was a really good and appropriate question. Why are you asking? And they said, well, we can see something. Well, what are you seeing? And how are you seeing it? So they described what looks like that fuzzy snow on the screen when you can't get the TV channel to come in and you have to adjust the aerial or the bunny rabbit ears on the TV, telling my age a bit, but that's how they described it. And he asked them, how come you can see it and I can't see it? And so they said, well, we work with the spirit. And so the spirit helps us to see because we've asked them to help us to see how to help you. And so we're just catch glimpses of it. That looks like that fuzziness, that snow around your neck area. So we asked, have you ever had anything happen around your neck? And he denied anything, didn't want to talk about it. Started another conversation on completely different topic, and that went on for a little bit. And then finally he said, well, yeah, I did have something happen to me. My father tried to stab me in the neck with a fork when I was younger. And my father was drinking. And he said, but what are you going to do about it then? Another good question. And they said, well, we can help you with that. We can help clear that away. And he said, are you going to have to touch me? And they said, no, we're not going to touch you. We're going to sing a song for you. And we're going to use our smudge medicines. And he said, that's it? You're going to fix me by singing a song and smudging me off? And they said, that's the first step. And so he gave them permission and they sang a song and they smudged him. And he said, well, I don't feel any different. Did the fuzziness go away? And they said, almost. But there's something you have to do to help yourself. And you can do to help yourself. And he said, what's that? And they said, well, do you ever get into arguments with anyone around here in the treatment center? He went on to start, explaining that it was always somebody else's fault, but did admit that he frequently got into arguments, which led to a lot of wrestling and sometimes some fights. And so they said, okay, so when you feel like you're going to yell at somebody, or you want to get in somebody's face, or you just feel like lashing out and punching the wall, stop. When you feel that way, you know what it feels like? And he said, yep, I know what it feels like. And so when you feel that rage coming on, you go to the kitchen, you ask them for your medicine. And then you sit down in the dining room and you eat your medicine until it's all gone. And then when you're finished, go find one of the counselors, one of the staff, and tell them what you are feeling. His medicine were peanuts and blueberries. Now the peanuts were behavior modification technique. By the time he had taken the shells off the peanuts and eaten them, he had started to de-escalate in the emotional energy that he was experiencing. And the blueberries were spirit medicine. everywhere across the land, our people, they pick the berries, all of the berries that come in their seasons, because they're the very first food of our mother, the earth. So they are an important medicine for our spirit. And that's what they said to him. You need the blueberries because they're going to help you with your spirit. They're going to help your spirit to become stronger. And he said, they told him, when you eat the blueberries and the peanuts, over time, you're going to be able to talk about things better than using your fist and using your physical presence. And so that's what he did. Over time, he would go and ask for his medicine. He would get the blueberries and the peanuts. He would find a counselor and sit down and talk about what he was feeling and what he wanted to do. And it would help him. And it did. It helped him over time. That's an example of culture as the foundation, relying on our medicines and relying on the teaching about those medicines to understand the meaning and the purpose of why we do things. Being on the land is also critically important. In fact, we developed a First Nations land-based service delivery model. So this was in the time when a lot of communities who were dealing with suicides, other kinds of trauma, of course, opioids and other substances like alcohol, and they were going out on the land. And this had happened for a long time, for a long time. In fact, in the territories and Northwest Territories and Yukon and Nunavut, they went out on the land a lot for programming for wellness, because there were and are no First Nations or Inuit specific addictions treatment centers. And so they would go out on the land. As well, the treatment centers across Canada, the NADAP adult drug and alcohol programs, as well as the youth programs, were offering land-based healing services. And so it became more of a conversation, and then government started to ask, what is land-based services? What is land for healing all about? Communities are starting to ask and talk about land for healing in their funding proposals, but there isn't any literature that we can draw on to help us understand that. When we ask First Nations, they say things like I introduced earlier, that's our way. Being on the land is critically important, but they couldn't describe more about what was involved. And they also chose not to describe more because they believe that if I sat down and talked to you about our understanding, our cultural and Indigenous knowledge for being on the land, you wouldn't understand it anyways. So there was this gap, a need to understand what it was so that we could create the right policies and funding to support it, but also to formalize land for healing within policy and program design and delivery. Now, this is a process of decolonization to formally, in a toolkit or a guidebook, describe land for healing. And so when we talked to many people about land for healing that were offering those kinds of programs, they said it's an aspect of self-governance. It's a way, a significant way to determine your health. And when you think about the attachment that is so necessary and critical between an infant, a newborn baby, and the mother at birth, is a significant time for attachment that supports their health and their wellness across the lifespan. It's that same kind of attachment to the land that is necessary for wellness. It's a core element of who we are. It's part of our culture. Land is understood as a teacher and a healer, teaches us about relationship. And also it's a place to develop culture-specific life skills. And so land for healing is critically important, part of wellness, and is being used alongside clinical services for substance use. We developed the Native Wellness Assessment to measure and be able to create evidence in a way that was understood across First Nations communities, a way to tell our story based on our knowledge. And so the Native Wellness Assessment is a Class B assessment. It measures what it's supposed to. And it measures hope, belonging, meaning, and purpose. So in a conversation across Canada, across the diversity of cultures and languages and land of First Nations people, we had a conversation about what is wellness? How do you support wellness? What are the cultural practices used to support wellness? And then when we do invest our cultural practices, what should we expect the outcomes to be? And so through that conversation, we defined hope, belonging, meaning, and purpose as the outcomes of using culture to support wellness. It's not measuring deficits, it's measuring wellness. And so we've collected data now for the last 3 years, and we consistently see an increase in various aspects of hope, belonging, meaning, and purpose. And so the wellness assessment, it asks a number of questions, 66 questions about spiritual wellness, emotional wellness, mental wellness, and physical wellness. And there are 13 indicators. There are a number of common cultural practices that are also rated in the Native Wellness Assessment. So at the bottom of the screen where you see groups 1, 2, and 3, those are specifically the groups of cultural practices. So at the bottom, group 1, it's the bottom of the slide I'm talking about. Group 1 are things that happen daily and maybe multiple times a day, such as prayer and smudging, use of our traditional medicines. Group 2 are things that happen more on a weekly or monthly basis, such as a sweat lodge ceremony. And group 3 are cultural practices that happen more seasonally or maybe annually. Maybe they're things that are require more supports, such as a ceremonial practice. And so we wanted to make sure that what we were developing evidence for was specifically the cultural practices and not all of the other things that a treatment center might do. And so it's the 13 indicators that are measured, connected to the cultural practice, that help us to determine the increase or the change in wellness over time. And so what happens is the wellness assessment is administered when somebody comes into a program or a service that's offering culture, and then can be someplace along the way, and then when services are finished. So we consistently see a significant increase in belonging and purpose, and then over time, an increase specifically in meaning. But we filtered all of the data because we wanted to look specifically at the cultural practices connected to land. And so these results are result of cultural practices that took place on the land. Community development, ownership, and capacity building is about investing in workforce development. It's about investing in community policy and programming. It's supporting First Nations government, and it's the respect for community strengths. Now, as nurses, you think, well, what's my role, and what do I have to do with workforce development, and what's my role in supporting First Nations government or coming up with policy and programming? But I want to say that every practitioner, every clinical support serving First Nations communities have in some way influence in all of these areas. And so I want to talk to you about what that means. Now, this is data that comes from our community-based First Nations opioid and methamphetamine survey, and these were the results at the end of March in 2021. And they represent about 1,000 people. I think we're up to about 2,500 people who have participated in this survey. And what we see is that a third of the people who participate in this survey are acknowledging that they're using opioids in a harmful way. They're taking more than they're prescribed. They're taking opioids outside of prescriptions. They're using multiple types of opioids at the same time, and the most popular ones are Tylenol 3 and oxycodone. The reasons they're using it is they're having a rough time. And why are they having a rough time? Because they can't get rid of the upsetting memories they have over their lifetime. They've had their friends and family attempt to take their own life, and they've also lost friends and family to death by suicide or premature unnatural death. They've also experienced community crisis or disaster. A high majority, almost 100%, have had family members who have been in residential school. And so Maria Yellowhorse Braveheart talks about intergenerational trauma. And that's what this slide represents, is that trauma transcends generation after generation. But it's not just an individual or one family. It extends across the whole of the population in First Nations communities. And so they're having a rough time because there's never been any focused mental health services for First Nations in their communities. And our culture was outlawed. And so our cultural practices were not lost, but they went underground. People did not have access to our cultural practices. And so they were left with no means to resolve all of the trauma that they've accumulated and continue to accumulate over time through the continued grief and loss, child welfare issues, unemployment, legal issues, and racism. And so people take or use opioids in a harmful way because they need relief from pain. And it's not just physical pain, because now they have a desire to get high, or because of peer pressure or family pressure. So those are the reasons why people are using opioids. But in our communities, where do we focus most of our attention? Is it on the family that gets the attention because they're experiencing grief and loss? Maybe a grandmother has lost her grandson, and so she's crying in her grief and loss, and she's pressuring chief and council to make a decision to ban those families who are selling drugs and alcohol. Or is it the angry grandmother who's angry because she's been impacted, her family has been impacted, her children have been impacted, her relatives have been impacted by drugs and alcohol in the community? Maybe she has family members who have been captured through sex trafficking, or children that are being used as drug mules. And she's angry and she's saying, we have to get rid of these people, ban them from our community, create a ban council resolution that says they can't ever come back again. Or is it the people who are using drugs, the people with lived and living experience? Where is their voice in what we do about addressing the health and wellness of First Nations people in rural and remote communities? Most of the harm reduction programs are urban-based. So what about this voice? What about the voice of people who are using drugs and alcohol? And then when we try to do something about it, are we only relying on Western clinical evidence? Where is our culture? And then there are those people in our community that are natural helpers and supports, people with compassion. Where is their voice? And it isn't just one voice, as you know. There's many voices and many perspectives, and we have to listen to all perspectives. And so joining in a conversation that brings those voices together to address stigma and ask the questions, how can we support people who use substances to access what they need? And how can we involve people in culture and our own traditional practices and medicine if we don't welcome them or make them feel welcome? We can't create change for someone if they've overdosed or their substances, the opioids that they've used are poisoned with fentanyl. We can't do anything to help them after they're dead. So how do we address the myths in our community about substance use, addiction, and harm reduction? Everyone has a role to play. And we have to understand that this accumulation across generations of grief and loss puts people 3 times more at risk of using opioids in a harmful way. And we also know that people who have a connection to someone else that cares, that have a role model or a mentor, somebody that they can talk to seek guidance from, or they believe that their cultural identity matters. Those things are the #1 prevention for using opioids in a harmful way. And that's coming from our community-based survey. Oops, I see I didn't change my slide there. That was the slide I just spoke to. But if we leave out culture, then we continue to practice in a way without seeing the results. Everybody wants evidence. And so I've presented to you evidence that culture works and makes a difference. If we leave out evidence, then we're not fully addressing the issue. If we say it's not my job, and I know that there are many barriers to scope of practice and what you can do, but a conversation with a chief and council who wants to understand opioids, methamphetamines, sedatives, other stimulants. They want to know how they work and how they affect people and get your guidance and advice about what to do. Those conversations contribute to community development and using Indigenous knowledge. We know that opioid and methamphetamine use together create significant harms for people. But if we think about what are the issues surrounding that substance use, there's a 43% of the people who have participated in the survey never had enough money to buy food. Poverty, food insecurity, using methamphetamines is one way to get rid of that, is that hunger. And that it's not just one drug at a time. There's multiple polysubstance use. And a third of the people talk about no treatment available to them for opioids and methamphetamine. They know what treatment options may exist for them, but they have no way to access them. There's a high, at least 24% of the people who have answered the survey have attempted suicide as a result of their opioid use. Tells us a lot about a trauma-informed approach that's necessary, meaning we can't deal with the intergenerational trauma in one conversation. We have to help people get access to services to stabilize and then at some point down the road address the intergenerational trauma. Even for people who have gone to treatment, have sought treatment throughout the pandemic, and mostly virtual treatment, the right side of the screen with the red square boxes around the blue bars indicate an increase in severity of drug use, substance use. And so there's some instances where substance use decreased in terms of how much they're using. Sorry. So if let me just find an example here. Opioids. Nope, that one increased too. So what this slide is telling us that there's less people using, but the people that are using in a more severe category, and that's 20 or more times a month. So one side with the red bars is during the pandemic, and the left side of the screen is pre-pandemic. Substance use has increased. And those individuals are people who have accessed virtual treatment services offered by the National Network of Adult and Youth Treatment Centers. They've provided virtual services, they've registered these individuals, and they've done assessments with them. And again, they're using the Native Wellness Assessment. And they're able to demonstrate that even through virtual services, and this is just talking about culture, getting access to elders, talking about the importance and significance of their identity and culture makes a difference. And quality care systems and competent service delivery is about that, and investing in relationships that I talked about. And it's also developing awareness of your own comfort level with ambiguity. So talking about culture and cultural practices, they're specific to the nation of people, their language, and their land. And so if you're asking somebody in Ontario about their cultural practices, and then you try to apply that same learning to culture and Indigenous people in BC, it's going to be completely different. And if you focus on the behavior aspects on the way that we do things, it creates further confusion. And so you have to understand that there are commonalities across cultures, but the way we practice cultures is very different. Meaning, similarity, practice, different. And so learning is first by listening and observing, and then asking questions, asking why. Learning, asking why, so that you can understand how to support, rather than asking why as a judgment. So Indigenous harm reduction is about grounding our approaches in Indigenous knowledge, language, land, and ceremonies. And it's expanding our understanding of what harm reduction is, and thinking about it in a community perspective. Of course, this is a scenario that was not possible throughout the pandemic. And many people understand that this is a picture of a powwow, people gathered in a circle, but every single aspect of this, what you're seeing in this powwow arena has meaning. The circle has significant meaning. The eagle feathers and the staffs and on the regalia have meaning. The jingle dress in the forefront of the picture has meaning, as well as the shawl dancers. Every type of dance has meaning. And the way that they dance, the way that their feet touch the earth has meaning. And we think about this as a social event. It has a lot of meaning. And so again, culture is not just behavioral. We do see and observe and enjoy what we see and hear and feel, but it has meaning, and that meaning is connected to stories that have been passed on from one generation to the next. And so there's a difference between Indigenous knowledge or sacred knowledge and Western knowledge. Western-based knowledge and evidence is theoretical until it's proven. Our original knowledge is given by the Great Spirit. Knowledge in the Western society or conventional evidence has ownership and authorship. And sacred knowledge or Indigenous knowledge is carried by the student and the teacher for the people. It's not owned. It's not possessed. It's not a possession. One is held, it's public knowledge, and the other is held in trust for the future. One is about testing to determine validity and exactly where it applies, whereas Indigenous knowledge is translated across generations, across contexts, while maintaining the truth and the integrity of that knowledge, but applying it in different contexts. The citation is, where that where the information is knowledge is published, and citation of Indigenous knowledge or sacred knowledge is the sacred society or naming the teacher where that knowledge was gained. And I'm not sure, but my time is up.
You have about a minute to do your last 4 or 5 slides.
Okay.
Carol?
So in our conversation with First Nations communities, they have said that ceremony, sharing circles, that culture is an important element of community-based treatment alongside access to opioid agonist therapy. And we have to remember that attitudes that support harm reduction is that everybody has the right to health. Across this country, there are too many public health units or local health authorities that do not see their obligation and responsibility to the health and wellness of First Nations communities, rural and remote communities. So everybody has the right to health. We have to accept people where they're at with their choice without requiring abstinence, and that services to First Nations people are require community-wide responses. We also have to remember that not all substance use is problematic, and that people who use drugs are critically important for shaping harm reduction policy and services, and that we have many different populations with their own unique needs, and we have to ensure that we are attending to those needs. And we have to collaborate with partners. And this is my last slide, that a hub and spoke model where, and I learned this from May Cat, that the community is the hub and the other services from outside the community are the spokes that work alongside community-based resources such as culture-based practitioners, land-based services, the chief and council, working with ensuring that there's rapid access to addiction medicine and harm reduction efforts. So I want to say thank you very much for allowing me to share some time with you this evening, and I look forward to listening to Brenda. Thank you.
Thank you very much, Carol. That was great. Man, we could listen to you all night. But we need to give Brenda a little bit of time here as well. So Brenda, if you want to turn on your camera and your mic, go ahead.
Thanks, Carol. That was a fantastic presentation. Ani Bojo, Wapsaquestishna Cause, Magisi Dodam, Doki Stunjaba, Okikanda Dijaba, Nishnawbe and Dow, Debendigosa King. I come to you from Nipissing First Nation along Lake Nabizing, which is the home of my partner, but it's too dark now, but usually I can see across the lake to my own community of Dokis. So I'm happy to join you this evening. And I'm happy that I asked Carol to go first because she did a lot of really great discussions about the framework, which will allow me to skip through some of those pieces. I'm going to talk to you today about the second part of our presentation, which is on child and youth mental wellness. I'm just making sure that folks can see my slide as I make my PowerPoint presentation come into a presentation format, I should say. So, okay. Oops. So on the screen, you see pictures of young people, and some of these young people you may recognize. These are young people who we would consider as leaders, as influencers, as young people who have given us a vision of wellness, who have given us a mandate of wellness. And each of these young people have done work around taking care of their well-being. And that work is things that they may have done partially on their own, but often surrounded by family and surrounded by community. We can see here in the middle of the picture, Shannon Kustashian, who demanded the right to education, to safe and comfortable schools in First Nations communities. She's passed away now, but she led a grassroots initiative talking about the importance of education for First Nations children and about the importance of access to safe schools where kids could go and learn and have opportunities and experience successes, and to feel that schools are part of communities and help communities to grow. We see on the far right hand, top right hand, is a picture of Autumn Pelche. And Autumn Pelche is a water protector. You know, she learned the teachings of the water from her auntie Josephine Mandamin, who's passed away now. And she continues to do that work. She's just a young person. At the age of 17, she's been on the international stage. She is identified as the water commissioner for the Nishnawbe Nation here in Ontario. And she goes to school and she leads a very everyday teenage normal life. But she is grounded in her teachings, in the culture, and in her family. And she has learned early on that she has a role to play. And that role is something that she was born with. And it is something that she believes she has an obligation to carry through. You see pictures here of young people like Thieland in the bottom right-hand corner, who uses ceremony and uses his understanding about influencing change in governance, influencing change in policies. And, you know, he walked in Prime Minister Trudeau in the first election, but he continues to do influential work. He bikes every year to bring awareness to wellness in communities. And he continues to ensure that we are talking about what do we need in our First Nations communities for young people to be successful and to have opportunities. Some of these others are people that you may not know, but in the bottom left-hand corner is a young woman from my own community and her partner, and they live a traditional lifestyle and bringing up their young children in the traditional lifestyle. And what they talk about is the importance of being connected to community, being connected to family, and recognizing that within our communities, we have a responsibility to support young people, to let them know that they are cared for and they are loved, that we have expectations of them, high expectations, because we believe in them and we believe in their their gifts and their strengths. We as communities and family members provide them with the opportunities to gain confidence in the gifts and the strengths that they were born here with. And they teach us about how giving back to community and believing in ourselves can make a difference and a change, not only for themselves, but for everybody around them. And so, I think our young people continue to push our understanding about the importance of wellness. The First Nations Mental Wellness Continuum Framework has a quote, and it talks about how mental wellness is made up of many things. It's made up of our culture, it's made up of our language, our elders, our families, and creation. And we have to have all of those things in order to realize a healthy life, whether that be at the individual or the family or the community level. But without each of those pieces, we cannot live a healthy life. And each of them require the investment and require space to be able to learn about our wellness. So Carol has spent time talking to you about the framework. And so I'm not going to go into the pieces of the framework, but I'm going to spend my time talking about the foundation of culture for child and youth wellness, and link that to things like community development and ownership, and look at the importance of making sure that we have a quality system of care for young people to realize their well-being in the mental health area and otherwise, and that we need what is it that we need to do to be competent to support young people and their well-being, and how can we be good partners in that work. There's lots of information, and Carol talked about this. If we start by talking about the deficits, we're going to focus on the illnesses. And so this data is usually the kind of data that we find when we think about looking at children's mental health. We don't often talk about things from a positive perspective. And so that's why I wanted to talk to you first about the faces of the young people in our communities, because they come to you, like Shannon Kustachin could have talked about how unfair it was that she didn't have a school to go to for the first 8 years of her life, but rather she talked about the importance of education and the importance of what we can do when we have safe schools and comfortable schools. So she talked about it from a positive perspective, a strengths-based perspective. But we know that young people in our communities aren't always given that opportunity to talk from a place of wellness. They're often looked at and talked about from the deficits and what they don't have. And many of those deficits and what they don't have often have to do with lack of access to services and lack of access to resources. And so we find Indigenous young people often struggling with mental health issues, and they struggle with getting access to treatment when they have difficulties around their mental health. Carol talked to you about intergenerational trauma, and she talked about how intergenerational trauma is one aspect of something that we need to attend to, but we need to attend to that in a larger understanding about people's well-being and what makes up their well-being. And so in the same way, we know that Indigenous children have been impacted by colonial measures, whether that be the Indian residential school and within their family structure, lack of access to resources, and on and on. But we know that Indigenous children continue to find themselves struggling with things that all other children do as well, like depression and anxiety. And we know that during the pandemic, it's really been heightened and reminded us that Indigenous children require supports in ways that maybe Canadian children don't, because they have additional challenges in their life. A lot of Indigenous children have also talked about the difficulty with getting access to services and resources. And many of them have spoke about the fact that they have never sought mental health treatment. But rather, when we begin to talk to young people, what they tell us is that they're far more likely as Indigenous kids to seek help from their parents or their peers than they are from mental health professionals. It does say here that they don't necessarily seek it from healers. And I want to talk about that in a moment. But first, I want to say, why is it that our young people say that they're seeking help from parents or peers before mental health professionals? Well, one of those reasons might be that they simply don't have access to mental health professionals or medical professionals in their communities. But more importantly, I think a reason that we see young people reaching out to parents or peers has to do with a really strong fabric in our communities, often of families taking care of each other. And those families are usually very interconnected. We look in my community, for example, everybody is related. And so what's interesting is in the work I do clinically, we do service my community, not just Nipissing First Nation. And I've been in meetings with non-Indigenous professionals where I hold the same last name as some of the children or their family members. And of course, the question I get asked is, are you related? And the answer is yes. But then it requires, from a professional perspective, they ask like how we've dealt with conflict of interest and is it appropriate. But in our communities, we understand that when we support each other, we are we understand in our communities that people are interconnected, and because they're interconnected, we are able to find ways of using our roles in ways that could be helpful for each other. And so often my response is, we've had the discussion about how am I being supportive here? What is my role here? Am I in a role, for example, as a professional, but maybe also from a family perspective as an auntie or as a cousin, in ways that can be helpful to that young person. So we talk about in families that aunties and uncles and grandparents usually hold the perspective of being a caregiver that helps sets boundaries. That's what aunties and uncles do, is they set boundaries. They sometimes help with setting discipline, if you will. And so when we are working with our communities in that capacity, we'll get placed in a position of thinking of each other as aunties or uncles, and leaving then to parents the opportunity to develop relationships with their children and to develop caring, loving relationships, so that they can build a sense of non-judgment and communication. I know in one of the sessions or clients that I worked with, we worked with an elder, and we worked with somebody who really did not have good supports in their childhood, and now they were a young adult. And when we were meeting with them, the elder sat us down and said, we're going to meet with this young person, and I want you not to go in with the hat of being a psychologist or a social worker or a mental health worker or a health promotion worker. I want you to go in thinking about what role you play in this young person's life, because this young person was seeing all of these different professionals in their community in a different way, but all around the same issue. And that was around grief, loss, and trauma. And so as the elder sat and talked with us, the elder said, I'm coming here in a grandmother role. I'm coming in the role of a grandmother, providing guidance, providing non-judgmental acceptance, caring, and love. And turned to each of us and asked us that question. And so when it turned to me, we talked about what role I was playing as a psychologist with this person, and that we acknowledged that I was coming really in the role as a big sister, somebody that this person would come to, look to for advice, looked as a role model or as a mentor, and then looked to, somebody else in our care team as a cousin, a cousin who could be present, was available, could always be counted on. And then there was somebody else in that role in the NADAP program, and she was a bit older. And so she talked about being that auntie, she was the one who would come and she would tell that young person, exactly how it was. This is what, is going on here, and this is what you should do. So, it was a little bit more stern, but caring still. And so we can see, for young people, sometimes when they talk about that they'll seek help from parents or peers, the likelihood is they're also talking about how within their community, they may have structures that help them to address their mental health issues. And then when they responded that they don't seek out support from healers, it may have been more because our young people are continuing to talk about the need to get access to culture, and that not in every community is that easily understood. How do we get access to culture? How do we get access to elders? How do we get access to healers? And so for them, some of this response might be that we need to be teaching young people about how do they get access to those things, and who are the healers in their community, who are the healers and the cultural practitioners that they can go to, because that's not always clear to them. But then in other cases, they may not see them, their grandparents, their aunties as healers, but more as aunties and grandparents, and might not have necessarily seen them as healers, even though that might be the role that they play in the community at large. So And then I think the other thing I just want to say about this one is that with the data, we know that rates of abstinence around alcohol and other substances are increasing in youth, and that kind of work tells us that some of the information we heard from Carol is really important. This one, we have access to culture. We're able to increase our rates of abstinence from substances, but that there is still work to do, that there's still work to do in helping our young people, helping our community members deal with those pains, those painful memories and experiences of trauma that come from their life or the life of within their family. And so the data really suggests that during the pandemic, we still need to help young people around dealing with things like binge drinking. For young people, we've asked them what are some of the things that they found most difficult in terms of getting access to, or barriers, I should say, to their mental wellness. And one of the first things that they talk to us about is that they've often felt that they've struggled with the stereotypes and with racism and discrimination. And they feel that it has often been a precursor or sometimes a contributing factor to mental illness in our young people. And so our young people have talked about how when they, when they leave their homes, when they're out in public, when they're in schools, and our young men are wearing braids and they have these long braids, that sometimes they're being teased, they're being bullied, they're being called girls, and they're not being recognized as being strong warriors, young people who are really learning about their culture and proud of who they are as young people. And so we have found sometimes that our young men will cut their braids off because they don't want to be teased and they don't want the stereotypes or the discrimination that comes with having long hair. We've also heard our young people talking about how when they come into schools, that they're sometimes seen as being different because they come from a First Nation community or they come from an Indigenous community where they speak differently or they look differently or they dress differently. And so often our young people find that makes them feel very disconnected and they don't feel a real sense of belonging. So one of the things that I'll talk to you tonight about is how do we create a sense of belonging and a sense of pride for young people. Another thing that young people say is that accessing mental health services or mental wellness services, there's often a fear of sharing information about what they are experiencing, whether that be in their home or in their community, because they're afraid that privacy won't be respected and that their families might be pulled into the child welfare system. And that's real fears for our young people. Often they or members of their family have been involved in the child welfare system and they've been removed sometimes from their homes for maybe situations that don't often make sense. We have had situations where we hear families have their children either taken away or that they're under supervision orders by child welfare systems because they don't have enough food in their house, or because their house is overcrowded, or because they are not able to keep their house clean, not necessarily because they are being neglectful or abusive to their children, but it is because we've set standards. Child welfare systems have set standards based on Western understanding about what are safe and comfortable homes, and that's usually large homes with multiple bedrooms and multiple bathrooms and a lot of place for people to live and to sleep. But that's not always the reality in our communities. We know that in our communities, people live usually in large numbers. Sometimes intergenerational families live together, sometimes because they're taking care of their parents or because there's not enough housing in the community. And so they live together, sometimes for necessity's sake. But that is can be seen as a risk factor for young people. And so there's a fear about talking about the fact that they share a bedroom with multiple, family members and maybe even with their parents. And then we've also heard that there are barriers around getting access to healthy role models and support systems. And those healthy role models might be within our communities, but they might also be within the school systems, because the school systems don't always have representation of Indigenous people. And so they don't have role models that tell them, about being proud of being in school or having good academic attainment and how to do that, and see that they can see themselves in those roles within the schools or within the roles within the community. And so that makes it more difficult for them when they don't have those healthy support systems. The National Collaborating Center on Indigenous Health has talked about Indigenous children and youth in Canada really experiencing a disproportionate burden of ill health compared to non-Indigenous kids, and how important it is that we ensure that there's access for culturally safe, strengths-based, family and community-oriented mental health programs. And when we do that, we see that we improve the livelihood of these kids into their adulthood. And I'm going to talk about some of those stories in a minute. One of the ways that we have to take a look at improving mental wellness for Indigenous kids is recognizing that the Indigenous social determinants of health, which is one of the rings of the First Nations mental wellness continuum framework, is that they often are very much tied into the well-being of children and youth, that those social determinants of health are complex, and they have complex needs, and therefore we have a complex response, I would say, to supporting well-being in children and youth. There are many social factors that impact health of Indigenous children. Many of them we know about, whether that be employment or income or education, access to services, food security, and those kinds of things. But from an Indigenous social determinants of health perspective, we also have to be thinking about how culture plays a fact and how language plays a factor in that. So when we don't give access to culture and language for children and youth, we are increasing their risk of not, realizing their full potential and increasing their risk of experiencing ill health later on in life. Colonial influences also play a part in the Indigenous social determinants of health. When we recognize that the social determinants of health are really rooted in social exclusion, marginalization, and racism, we begin to see why our young people are, have higher rates of involvement in the child welfare system, as an example, because we're placing those external beliefs and ideas about child well-being into our communities without recognizing how it could be valuable to live with our grannies or to live with our aunties and uncles, and how living close together and taking care of each other could be valuable. Now, there's a lot of cultural variables, however, in the social determinants of health that also can improve our well-being. And so when kids have access to spirituality, when they have a sense of connection to family, to land, and to community, when there's a sense of reciprocity across the beings of creation, all of our relatives, that can be really life affirming, I think, for young people. And when we see that there is self-determination in our communities in terms of making decisions about health, about education, about emergency services, all of those things improve the likelihood of young people. And so they are critical variables that we need to think about when we're developing mental health services for Indigenous children and youth. There are a number of risk and protective factors that improve well-being. Some of them I was kind of referencing already. And you can see if you go through this list that, you know, on one side, it's about loss, it's about deficits, it's about what either young people, Indigenous young people don't have or have lost as a result of colonialism, or the experiences they've had as a result of colonial acts. And on the other side are all of the things that are strengths and gifts of our communities and things that are being revitalized and returned. You know, so participation in land-based activities is one that can become a protective risk factor. The opportunity to practice and participate and hold traditional knowledge and skills is a protective factor. The opportunity to have cultural continuity at a community level, where that means having the self-determination that I was just talking about around governance, around health, around education, around emergency services, having buildings and spaces that are dedicated to cultural practices and cultural well-being. All of those things are about cultural continuity, revitalization of language. That's all about cultural continuity. Having protective factors is also about feeling that young people have the opportunity to contribute meaningfully to the wellness of the community and that they're useful. And we hear our young people talking often about wanting a voice and needing a voice and being able to participate meaningfully, whether it be at a governance level, at a community planning level, and even within schools, because that gives them those opportunities to meet those high expectations of success. Having positive role models, I've talked about already, the reclamation of language, and the participation in cultural activities and ceremonies and good family and social supports. All of those are protective factors that ensure well-being for Indigenous children and youth. And so when culture is such a strong and important social determinant of health, it pushes us to think more holistically about the concept of health and how do we integrate that into mental wellness. It means that, you know, the framework talks about achieving that requires that we think about the balance of mental, physical, emotional, and spiritual aspects of life, and think about hope, belonging, meaning, and purpose. And how do we use holistic, culturally relevant interventions to support that? No, so Carol mentioned this as well. You know, we need to be able to have a focus on strengths. I think she talked about not looking at deficits because it looks at it from an illness perspective. And so this is the same comment, really, that when we have a focus on strengths, it leads us to more of a vision to wellness. And when we help young people to focus on their strengths, it leads to a vision of wellness and hope and opportunity for them. You know, wellness in our communities is supported by things like culture and language and our elders and our families, and by land and our relatives in creation. You know, when we utilize our Indigenous knowledge and our evidence and our practices and our language and our ways of knowing and being, we find young people describing themselves in much more confident terms. You know, I think we've come a long way in our communities because, you know, even 30, 40 years ago, we didn't outright talk about language and its importance. You know, that was something that either you spoke or you didn't, you know, and it wasn't something that communities were were not trying to revitalize at the time. You know, Indigenous knowledge was passed down very almost passively without acknowledging the importance of that. But, you know, many of our experiences were sitting around a table with our grandmothers and our aunts and our mothers, and watching them be strong leaders. You know, in our communities in my area, we had homemakers clubs, and the homemakers clubs would bring all of the women together, where they would come together and they would sew, they would bead, and they would pass on that knowledge to the young women coming up, those new young parents. And as those young parents were sitting there, their children would be running around and being taken care of by all of the women in the community, and now that is done, those things are still happening, but they're being talked about in terms of how they contribute to well-being for young people. And so I hear young parents now saying, I really enjoy going to that beading class or that regalia making class. I bring my children and we sit and we visit, and I visit with, my aunties and the grannies in the community. And I talk about the struggles of raising my children while my husband is off working out of the community or he's on the land. And they give me advice on how to be a good parent. And they sometimes intervene when my children are acting, are misbehaving, or I think misbehaving. They'll intervene and they'll talk in gentle ways to my children, or they'll stop me from disciplining my child and say, it's okay, let them, they're children. They need to run around, they need to blow off steam. So they're teaching, the ways that we teach are often in very organic ways that make people feel safe to learn, feel safe to understand their roles. Our culture focuses on strengths, and this is a picture of how a young boy is learning about his role in the community and his role in this case in the powwow circle. And so he's the head youth dancer, and he is with his grandfather, who was the head male dancer, and his grandfather is teaching him what is his role as a youth dancer, but what is his role in conducting himself in a respectful way, with love, with caring, with bravery, with wisdom, and doing all of those acts of kindness, I guess we could say, for other young people who are maybe starting out in the powwow circle. So when we give children an opportunity, both children and youth, an opportunity to learn through intergenerational transmission of learning, we give them a sense of who the role models are in their community, that they are within a supportive network when they know that their grandparents and their aunts and their uncles are helping them to learn in caring and kind ways. This is a slide that I stole from you, Carol. And it's one that comes from Peter O'Cheese, that this slide talks about the stages of life. And so in our culture and in our teachings, we talk about the 7 stages of life. And here there's 2 more that Carol added around pre-birth, as well as at the time of our death or spirit journey. But in those 7 stages of life, there are teachings, and those teachings talk to us about what are the expectations that happen during each stage of life. And so it's similar to what you may be more familiar as those developmental models that you might have learned from Erickson or Maslow. This is the same sort of thing, in the sense that it talks about different things that gets achieved at different stages of life, and what can happen in those stages of life. And the 2 yellow ones are in the child and youth years, the good life. And so the good life is when our young people are learning about how they belong in this world and how they fit into this world, and giving them that sense of who they are and where they belong, and about their community. The fast life is more when we move into the adolescent years, and that's a time of learning about our identity. So it's learning about the meaning of who they are, and what they can contribute, or what are their gifts, and then the wandering years is sort of that early adult years, and that's a time of learning about sort of our purpose, what is our purpose in life. And each of those areas talk to us about how we can support children and youth during those times, and what is our roles as adults, as elders, as aunties during that time to help kids to get a sense of belonging and meaning and purpose so that they can have hope. You know, the wandering years is the time when we think about, young people are more at risk of suicide. And so we have to work at helping them to recognize hope in their life. And when we do, in doing that, that means it's helping them to recognize what are their gifts, what are their strengths in the fast life, and helping them to realize what those gifts are and how they can be used in their young adult lives and further on into their life. So using all of that and helping them connect to what they've learned in the good life about how they belong, where they belong. So, in their community, like Mary introduced and talked about the importance of her clan family and her nation family. So helping young people in each of those stages. In fact, we can start that really pre-birth by helping to at the time of conception, to help the young parents to prepare for bringing a young life into this world, and to think about what it is that they need to live a good life, to live that life of hope, belonging, meaning, and purpose. And so when we equip young parents with different types of tools around helping them seek out the spirit name of their child, helping them to ensure that they have the teachings around, whether it's the moss bag or the Tikanagan, learning the songs that can be sung while the baby's in utero. All of those things are critically important. I have a friend who talks about with one of her children that every day her mother and her mother-in-law came to visit her while she was pregnant with, I think, her second child. And every day they would talk to that baby in utero. They would tell that baby how much they loved them and how much they were anxiously awaiting their arrival, and how excited they were, and how special they were, and how important they were within this family. And they did that each and every day. And when she had her baby in the hospital, they came to visit those two grandmothers. They came and they visited, and the nurse wheeled over the baby to show the grandparents, and that baby was crying. That little guy was crying really, really hard, and he was the only one who was crying. And all of a sudden, those grandmothers, they just started talking to that baby, and they said, Ani, Bojo, and they greeted him in his spirit name, and that baby stopped crying immediately. And he turned and he looked at his grandmothers because he recognized the voice. And so when we give those tools early on at pre-birth, we start early on to help them understand where they belong and where they fit in. We as new parents will get lots of teachings from elders and from our grandmothers about looking for that spirit name for our children. And I remember at the time of my first pregnancy, and I was talking to the elder and I said, I'm going to have a baby. And she said, you need to look for that baby's spirit name. You need to give tobacco to somebody to get that name. And so, I thought it made only perfect sense that it should be this elder, because I was close to her and I knew she gave a name. And so I did. And she gave the name to my son, which was Wasabisa, which is sunshine after the rain. And at the time of my labor, it was, we had 3 days of rain, and I labored for 3 days during that time of rain. And on the fourth day, the sun came out. But just before I went into the hospital, my dad on the third night, he called, I was talking to him and they were checking on me and seeing if I was still in labor. And he said, tomorrow I think that baby is going to come. I think now that I think there's going to be sun tomorrow and the baby is going to come tomorrow. And I realized in that moment that my dad actually held my son's name. So sometimes we don't always know who's going to hold that name, but it is around us. And, you know, my dad talked about that baby is going to come because the sun is coming out, and he was ready to come because the sun had come. And we then find with my son, now he, you know, he took a long time to come. But after he came, you know, there was lots of joy and lots of happiness. And today I see that my son takes a lot of time to get things done. But once he gets things done, he does it really well. And he does it with joy, and he does it with happiness. And so he continues to move into his name and the gifts that come in his name. We know that if we help our young people by dressing them in those gifts that they have, by helping them, you know, realize their name, then we are helping them to connect to their spiritual identity. We're telling them that these are important gifts. Here we see that when we put the baby in the Tikanagan, or we put them in the moss bag, and we dress it up with their name and their clan, we are giving them information about who they are and where they belong. And that can happen at birth. But we also know that ceremonies sometimes have been lost, and it is only later on in life that our young people are seeking to get their names. And so I also have a picture of young women who you know, received the teachings around their colors and their clan, and they made ribbon skirts. So they spent time together learning about you know, some of those traditional practices, and then received their name. And that they did that in a place where they were supported by a strong family network. And so when we do that, when we help people to dress up and recognize their spiritual identity, it improves a sense of well-being for them. We know that our teachings have told us that we carry so much of our spiritual identity and so much of who we are within our DNA. And in our culture, we have different things like the moss bag or the Tikanagan, where you can see the laces mimic the DNA. And so we were often told that it was our responsibility to be reminding the baby about how they are connected to their identity throughout. Connections happen by when we give kids the opportunity to connect with their cultural knowledge and their language throughout different parts of their life. We're giving them a real path to wellness. There was here in Nipissing, they have a high school on reserve, and the teacher told me a story. He was the language teacher in the school, and he also taught the cultural programs. And every day he starts the day off with a big drum, just like you see here in this picture. And in the early years of the school, there was a lot of young people who came from different communities. They don't all come from Nipissing, and they would come and sit around the drum. And a lot of these young people are kids who were not successful in other school systems. They, you know, were being expelled. They had difficulty with learning, with their behavior, whatever it might be. So they ended up at this school, which is a much smaller school, a more intimate school. And so they were drawn to the drum, and he would invite them to come and sit around the drum and to learn the songs with him, and to learn how to drum. And so he realized that they came and they enjoyed doing that, but he also noticed as he was looking around the drum that, you know, they were coming, and you could tell that, you know, maybe they had used the night before, they'd been drinking or using substances, they looked tired, maybe they'd been in a fight, you know, they looked like they hadn't had much sleep, they weren't taking care of their hygiene. And he talked about how that really concerned him. And so, you know, he would gently talk to them about, you know, taking care of themselves, of their hygiene, of getting enough sleep, of, you know, being respectful of their bodies. And then one day he said to them, you know, the teachings of the drum tell us that we need to come here with respect. We need to come here with a clean spirit. We need to come here with a clean body. And so if you're going to be using, you can't come and sit around the drum. And so those young people, you know, they had respect for him. They said, okay, and they didn't come back. And then he said for weeks, he realized, you know, he was sitting at the drum alone, singing every morning to start off the day. And those young people weren't there. And he thought, maybe I really made a mistake. Maybe I shouldn't have said that. Maybe I should have allowed them to stay around the drum, because maybe this was all that they had. And I took that away from them. And shortly after he thought that, the next day, a couple of those young people returned to the drum, and they looked good. You know, they had a shine in their eye. They were dressed well. They looked like they'd had a good sleep. And over the weeks, all of those young people eventually trickled back to the drum, and they all looked like they were taking care of themselves. They were looking at being respectful to themselves, to their body, to the school community, to the drum. And what he created really was a strong group of young people who began to embrace their cultural values, the cultural practices. And over the course of the 4 years, because many of them were in grade 9, over the course of the 4 years, they became the role models in the school. And by grade 12, these were the young people who were getting the awards, who were graduating on time, who were planning to go off the post-secondary. And one of the teachers said to him, what you did in grade 9 paved the way for these young people to be well, paved the way for them to have hope and to have belief and to have connection to the drum, connection to culture, and connection to language. And so it really helped them to think about how they build healthy coping strategies in their life. When we provide support to young people around transitions, and we can also help them to develop healthy coping strategies. So in our culture, we recognize that times of transition can be really difficult. And so, you know, when you look at the stages of life, there are times of transition. A common transition is when children move into adolescence, when they become young men and young women, when their voices change, when they grow, body hair, when they grow breasts, when they have their moon time, or they start their menstruation. Those are times that can be very challenging for young people. And so we have cultural ceremonies like the Vision Quest and the Berry Fast. And each of those practices is meant to support young people to think about how they can manage transitions. In the Berry Fast, young women give up berries for a year, and they learn a number of cultural teachings, and they are asked to create things, to do beading, to pick berries, and to give the prepare those berries and to share them with family members and community members. They make their own moccasins. They are given teachings about how their moon time is a very powerful time, and they themselves are creating medicine because they are becoming creators. They are creating life. And so they are given access to women, older women, and they learn about the importance of giving life. They learn about the roles of women, and they learn about the critical importance of the gifts that they carry as a woman. The same is true of young men. They also learn about their role of becoming men, of becoming protectors of fire, protectors of families, protectors in the community. And they are given access as well to men to learn about being, what it means to be a healthy man. But they are also given access to women, and women come in and sit with them and talk to them about the importance of what is important in a man, to take care of a woman, to take care of a family. And so they learn all of these things in their Vision Quest and in their fasts. And during times of fast, they learn to be able to deal with delaying gratification, which is one of the things that is very difficult in young years, in those adolescent years, is that delay of gratification. So they learn about how to delay gratification. They learn about how they can cope with difficult challenges in their life through fasting, through giving something up. They learn about their personal capacity, about what they are able to do, what their gifts and strengths give them the capacity to do. So we can use our ceremonies to help kids during dealing with times of transition. This is a slide that just talks about a research study that showed when young people are connected to their culture and they have a strong sense of their identity, it leads to some healthy outcomes, including pro-social behaviors in youth, a sense of strong values of belonging and mastery and independence, and generosity. It discourages things like risky health behaviors and encourages far more positive health practices. It combats having a connection to culture and strong cultural identity, leads to strategies to deal with stress and other negative health outcomes. It buffers depression and symptoms of depression and alcohol use in adults. And it acts as a protective factor later on in adult years from things like the impacts of discrimination and suicide and alcohol use. Children, youth in the school systems. We've heard from young people that being in the school systems, it's really important around transitions. And so work has been done to offer strategies through something called grad coaches here in the Ontario school system. And these grad coaches are like role models and mentors, and they have drop-ins with young people. They help young people to plan around transitions from high school to post-secondary school. There is talk about supporting them moving from elementary to secondary school. And they have found that these grad coaches who help support students during transitions in school have had higher academic achievements than their non-Indigenous peers. A big part of the work that the grad coaches do isn't just about helping practically learn about navigating the education system, but these grad coaches sit with young people and they will give them access to things like cultural practices. Am I close to the end of my time, May? I see you looking. Awesome. Okay, thank you.
You can sum up if you have a couple more slides, that would be fine. Thanks.
Great, thanks, May. And so they find that when grad coaches meet with young people and they give them access to culture, cultural practices and cultural ceremonies, it increases their sense of confidence. It improves their coping skills. It teaches them strategies on managing stress, and all of those things seem to be part of what leads to better academic achievements. On the land, camps have been are being used more to support holistic well-being. I'll tell you one story about that, and then I'm going to wrap up around talking about language, because I think that's a good place to end. Land camps are being used more and more frequently in schools, and they're being used more and more frequently in communities. And Carol talked about land-based healing. In a community here in Northeastern Ontario, they instituted a canoe trip, a land-based canoe trip program. And it was started as a way of supporting young people to build their resiliency. And so they identified young people that they saw that were at high risk of being involved in the justice system, dropping out of school, being involved in the child welfare system, those kinds of things. And they invited them on a canoe trip, a 10-day canoe trip that started sort of at the base of their land, at their waterways, and went around their island and ended up in the bay where the community is mainly situated. And they had the young people keep diaries of their time on the water. And they also every night would stop and break for camp and had responsibilities about setting up the camp. And different knowledge keepers and healers and elders from the community would come every night wherever they were camped, and they would tell stories. They would tell stories about the community. They would give teachings about being in that fast life. They would give stories that would talk about coping. And over the 10 days, they saw a shift of these young people. Many of the young people weren't happy to be on this trip. They complained, they didn't want to be there. But by day 3, there was a drastic shift in the young people. They were excited. They wanted to get up in the morning. They were prepping up the canoes. They didn't have to be pulled out of bed. They didn't have to be sort of, poked and prodded to get into the canoe without, they got in without any complaints, and they would paddle. And they would tell stories about how, they would go with 3 or 4 canoes, and they would encounter adversity. Sometimes it would be strong winds, or it would be rain, or it would be kids that were really tired. And they found that after day 3, these young kids would start to support each other. And so they would see, maybe a boat that was having difficulty getting through some challenging waters, or that they were lagging behind, and another boat would paddle forward or drop back, and they would shout words of encouragement to each other, saying, "You can do this, you've got it, you're strong, we believe in you." And that created a real sense of connection to each other, and a sense of connection over time to the land, to their communities, and to the stories of their communities. They began to see that when they were done the canoe trip, the kids would start setting up camp without being prompted, and then they would also start to take over the roles of the adult allies in the camp. They'd say, "Oh, I know you're supposed to be doing the cooking, but we're happy to take on the cooking. Why don't you have a rest?" And so they started to take on all kinds of roles, and really developed a strong sense of pride. And on the 10th day, when they are paddling into the community, before they round the corner into that bay, they could hear cheers because from their family and from the leaders. They would all be standing on the shores, and they would be cheering and calling them home. They would be singing songs to call them home. And the young people would become so energized as they came into the community. And they often talked about feeling like, "I've never been welcomed this way by my community. I've never been acknowledged. I felt so proud. I felt like I belonged. I felt like this was the place where people had my back and they believed in me." And they did a study to look at their resiliency before the canoe and after the canoe trip. And they found that the resiliency levels went up in these kids. And so we see that when we give them connections to land, when we give them connections to culture and teachings, it can really increase resiliency. And that's a little bit about what this talks about, is the connection. And I'm just going to end by I'm going to show this and just show that when we involve Indigenous knowledge and curriculum, and I'm not going to read the story, but if you have a few minutes and can read it quickly, it really talks about how this young person recognizes that there are different types of knowledge. There is Indigenous knowledge and Western knowledge, and both of those knowledges are equally important in lifelong learning or education of our young people. And so we do need the degrees, to live our life in the modern or contemporary context. But there is still a space, and there's still a place for the Indigenous knowledge, that traditional knowledge of being on the land, knowing about all of the nuances in our territory, knowing about how to trap, how to harvest. All of those skills are very important, and they can't always be learned in the classroom. And they teach us a sense of pride. It teaches us about our traditional ways of life. And so this young person says, no matter what kind it is, we will be better off with education. I am proud of my dad, and I'm learning from him. I cannot learn this from my teacher. My friends know very little of the traditional ways. So I am privileged to learn these teachings. The only difference between the two types of education is one is recognized and one isn't. So we need to recognize both types of curriculum or knowledge. And finally, I'm going to just end by talking about the importance of language, and I'll summarize it very, very quickly, May. Our language has been shown to promote resiliency in our communities right now. There is a real push around revitalization of language, and it is being taught in our communities. It is being pushed into our school systems more and more, and being really demanded, because it is the right of our young people to have access to our language. Our language, when we learn our language and when we can speak our language, it promotes a strong foundation and gives us stability and balance around how to live a good life, how to have healthy coping. When we can communicate in our language, we are enacting that spirit language that nurtures relationships and social interactions. It strengthens our ability to be social with each other, to create strong relationships, and not only human to human relationships, but relationships with creation. In our language, my understanding is it promotes a sense of tolerance. It promotes a sense of balanced thinking, because we recognize the importance. Our language talks about interconnectedness, and it talks about interdependency. So it teaches us that we need to be tolerant, that we need to recognize everybody has a role and a space in creation, and we all have something to contribute to each other's wellness. Indigenous language acquisition also leads to better executive functioning. It develops earlier, and it develops better critical thinking and problem solving. Within our language, my understanding is it's far more of a descriptive language, and it helps us to think through understanding that interconnectedness and how to work together, how to participate in building a good life that supports each other. We have seen that helping young people to learn language through immersion has actually led to better academic and behavioral successes. And it also lowers health issues like diabetes and suicide rates, and improves things like happiness and good health, and reduces high-risk behaviors like substance misuse. They have found that the ability to learn and use one's own traditional language is the strongest positive influence on resiliency, and it's even higher than culture. So when we hear our language speakers talking about, we could have good mental health, but if we don't have our language, if we bring back our culture, but we don't bring back our language, we are missing a critical foundation. And so language is something else. And so I'll end by saying to you all, what is it that you can do to promote language development in young people? How is it that in our role as nurses, how can we help our young people to understand, to give them access to their language so that they can learn healthy habits and behaviors that could lead them into a good life? And yeah, I'm going to end there. Miigwech.
Miigwech to both Carol and Brenda. So just to sum up some of the comments from the people who've been listening to you, there's still almost 200 people here. This is so wonderful, amazing presentation. This is a wonderful session. And you got many variations of miigwech, chimiigwech, chimigs, and thank you. So people were really very positive about what they heard tonight. And the message, I think, really went through many different caregivers here, because we have people from Nova Scotia, Victoria, Tyendinaga, North Spirit Lake, Windsor. So you've covered all the 4 directions very, very well in your participants. So we do have some time for questions. If you want to put them in the chat, we've had 3 questions that were already answered. So if people want to ask questions, certainly either log them here, or I don't know if we can open
May,
up
just to say miigwech, and for someone that is much less knowledgeable than most here, I can tell you that the learnings, as you were talking, I was even trying to Google some of the pieces that you were talking, like the tradition of the berries. I didn't know about that. And what a beautiful way, right? What a beautiful way of transitioning. It was explained in one of the articles I was reading as you were talking, putting the toys away and becoming a young woman. And what there is this magazine that speaks about women that talk about the tradition and how they saw young women running around, and then they actually brought them when they went through the transition. They came to visit them, so it one passes to the other. Just so beautiful, so beautiful. I missed, you said that there was, when you mentioned the one on the berries, you mentioned another tradition and I couldn't catch it up. Can you mention it again? I want to learn more about that. I want to read more.
Sure, Doris. It's the Vision Quest, which is what young men do during their times of transition.
Just beautiful. Thank you.
Do you have two questions? Maybe you can take turns answering it. For the first one is, I often get the question, why is Indigenous health so important, and find it difficult to answer. How can I answer this question while demonstrating the severity of issues surrounding this topic?
Well, I think it's important first to understand that all people's health is critically important. And when we talk about First Nations people, we also have to think about the context. And so First Nations people are called First Nations because they're the first peoples of this land. And our health is embedded in treaties. And so as we were negotiating the sharing of this land, there was a conversation about ensuring our health. And so that has been preserved as the Constitution of Canada was repatriated to Canada and identifies self-government for First Nations people. And so health is understood as a right rather than, well, I'll stop there. So that's one piece. Everybody's health is important. First Nations health is a right, and it's further, I see you laughing, you know where I was going with that, Marilee. It's further entrenched in the UN Declaration on the Rights of Indigenous People. So it's a rights-based approach entrenched in the Constitution and international treaties, declarations. And then when we think about the context in Canada, then why do we have the disparities? It's not because as a race of people that we are, somehow pathological, we don't take care of our health, and on and on and on, which is the stereotype embedded in racism. And it's embedded in racism because our knowledge and our practices around health also endured racism. So racism was not just a practice of, land and economy. Our language and our cultures were also endured racism. And so, that Janet Smiley, she often talks about epistemic racism, which is the judgment of which knowledge base is credible and evidence. Meanwhile, when there's the judgment of Indigenous knowledge as being credible or not credible is often from a place of not knowing what is Indigenous knowledge. So there's no foundation to conduct an evaluation about the credibility and value of Indigenous knowledge. And so we have these great disparities amongst the health of Indigenous people. And it's due to inequity. We don't all want a hospital in our communities, but we want health services that are relevant and culturally safe to First Nations, Inuit, Métis peoples. And so why is First Nations health so important? Because we have a right to life. Full stop. That's it. We have a right to life.
Right on. Brenda, I have a question for you. So there's the person saying, how would you bridge that reluctance between the individual and the community, where the reluctance of the individual is strong because they don't want the community to know their business? So what kind of methods would you consider to help connect the reluctant individual to the community health and culture?
Mhm. That's a big question. I think what I've experienced with folks who have a reluctance about being connected to community is helping to really starting from a place of non-judgment, and I think acceptance and caring. Usually when people come and tell me that they're reluctant about people knowing their business, it has come from a place of judgment. It's come from a place of being stigmatized or marginalized in the community. And often that has to do with our ongoing I guess, transmission of trauma, lateral violence and colonialism that occurs in our community. So I think when we start to support people from a place of non-judgment, and we can bring in other people who are non-judgmental, who are caring, who are accepting. A lot of the messages that Carol had is like that we have to recognize everybody has a space in the community and help them to see that. I think it helps them to grow. The story I was telling about that young person, and I was the sister and there was an auntie, that was a young person who had a lot of reluctance about working in the community. And so sometimes I think it is about being that person who can be there and who can be non-judgmental, who could be there when they need somebody without any boundaries almost. That if they are struggling, that they can pick up the phone and call you and you will be there to listen. You won't have limitations on when they can call you or when they can speak to you or what they can speak to you about. I think sometimes in our communities, the other challenge is that we have we've become so siloed that you can only come talk to me about this and not about that. And so people from an individual perspective feel like, I don't want to talk to you because I have to share my story here and share my story there. So for me, part of it has also been about really pushing the boundaries in our community about working more collaboratively and showing our members that when we do our jobs as professionals to break down the silos, to attend to privacy issues and to share in ways that are safe, then people are more likely to come into the services. When we could help people to meet their strengths, when we could have them come in and not judge them if they're using or if they're struggling with a mental health issue, and we meet them where they're at. If they're saying, I don't want help with addictions or mental health, I just want a job or I just want to have an income, and we meet them there with that and we help them attain those goals, they are more likely to have a belief that the community is there in their best interest.
Okay, that's great. So we're going to move now to first, thank you again and again and again. This webinar has been very popular when you look at the comments. Again, people have an opportunity to watch this again. Your slides will be available for people. You will get an email if you've registered within 48 hours to be able to rewatch this. So I'm going to ask Grace to do the closing remarks because there is Mary's going to do the closing prayer. Thank you.
Thank you, May. Just again, wanted to reiterate and thank everyone for participating in this important webinar and Thank you, miigwech, to Brenda and Carol for the depth and the breadth of the expertise and knowledge that you have brought to us today. We appreciate very, very much. May we thank you for moderating your webinar and for your support, and Mary for the traditional opening and closing, and of course Doris and Marilee for bringing your greetings and for your support as well, and Tanya Costa for supporting the technical and the planning components of this webinar. I'd also like to thank the planning committee members, Gahandagwas, Diane Longboat from CAMH, Lauren King and Kim Hillman from NAN, and Bernadette de Gonzague from COO, Chiefs of Ontario, as well as Winter Lipscomb, the Ontario First Nation Young People's Council. And we appreciate your support and for the immense planning that has been involved in this webinar. So before we close, thank you, May, for encapsulating what the follow-up items will be, but I will now pass it on to Elder Mary Deliri for the traditional closing. And please, Mary, let us know when you want us to pause the recording.
And so it's fine to keep the recording going. I just want to acknowledge all of the sharing this evening, the words that were shared, and the evidence of the truth and strength of who we are, people, those continuous threads of blood memory, the many ways, the many ways our culture, our ceremonial practices, the totality of our life continues to, be given expression. In that, we acknowledge and see. We see the hope. Especially, we see hope through all of the younger generations, who really are the fulfillment of the Seven Fires prophecy of the Nishnawbe people. And when we, in this way of connection, even in this virtual world throughout all areas of the land, we, in this conversation, and sharing in this conversation, we all have responsibility, reminded of that, of our responsibility as the four colors of humankind, that we all carry gifts from our origin, and we all have purpose. And so in that, it's acknowledging and saying miigwech to all who are part of the journey. And and I'm reminded of these words that they, there's just a small phrase in our Nishnawbe language, and it says "Gawin Nasha Gakijatod" or Gadoduman. Like when our creator, there was nothing that was created without purpose. Everything in creation has purpose. There is nothing that is without meaning. The same for us as humankind. Everything we do in each day in our life, never mind the whole purpose of life, that everything we do has a meaning and has purpose, or that is how it's meant to be. And so, I think about that in all who are part of this conversation this evening and participating in this by listening, by learning, and it's that purpose. There's purpose for each person, and that will unfold individually for each person in the work you all do as well. And so as we close the evening, we close, and just as we open, we acknowledge, we call the attention in prayer. In our prayer, we call of our Creator. We call the attention of creation, those spirit helpers. And so when we finish, we let the Spirit know that we are finished with the work that we set out to do, and we just say miigwech for the help that we have been given by creation, and that we continue to be given. And in that we include always our ancestors and those yet coming. Always in the nighttime, we're told we remember, especially our ancestors, our loved ones who have gone home. And so I'll just say these brief words of miigwech. Ahara shaga miigwech da shaga geminido gabazindaman da shaga nijana simanan. Rene gana gukwe chamagiga iganadamawa gakanawia. No kitamage da shaga. Adamino madsawad yakina. Niominek yashiga gitudoyan. Miigwech. And so that is all. Miigwech.
Miigwech, everyone.
I'm good. Go ahead, Grace.
Miigwech.
Miigwech.
Thank you for the invitation.
Thank you, Carol. And thank you, Brenda. It's been a pleasure. It's been an honor.